There's been tremendous research examining the neural correlates of schizophrenia using brain imaging. One of the exciting things to see in the field is that this research is beginning to move beyond cross-sectional studies that simply compare patients who are ill with patients who are healthy. Kochanov and colleagues present one of these new studies, and this study looks at the integrity of the brain's white matter tracts. This is a measure that has been firmly related to schizophrenia as a diagnosis, but the new findings reported in this manuscript show that not only do these perturbations in white matter structure relate to the diagnosis, but they also predict poor outcome. That is, patients who have more severe abnormalities in their white matter tracts do poorly with treatment. The importance of this finding is it begins to move imaging beyond a simple tool to compare healthy and ill patients and begins to ask questions about how these measures might be clinically useful, such as identifying patients that are more likely to have refractory conditions. Smukny and colleagues make use of brain imaging in a way that is different from in many of the studies that we see in the literature. Many of these studies examine simple cross-sectional relationships either between one disorder with healthy people or maybe among a number of disorders. Smukny and colleagues examine long-term outcomes in patients with psychotic disorders, and they use brain imaging at one point in time to predict the course of illness over this year-long period in these patients. And the tantalizing finding suggests that it may be possible to develop clinically useful imaging measures that can identify at baseline patients who are most likely to exhibit poor outcomes. And this is important because it suggests that imaging one day may be able to help clinicians to select patients who are at risk for particularly poor outcomes.